Welcome to Sodexo's Expert Series, where we talk to specialists from across the health and care system. We talk about the challenges, the solutions, with a particular focus on non-clinical support services. And today we're focusing on dietetics, and I'm delighted to welcome Hasina Aktar to join us today. Hasina is the Head of Dietetics for Sodexo Health and Care in the UK. So Hasina, I wonder if you can just start off by helping us to understand the definition of malnutrition, which we know is a problem within certainly the acute part of the sector.
I describe it in a very simple way, which is that malnutrition means poor nutrition. And that poor nutrition can be described as either undernutrition or overnutrition. I think a lot of the data out there is very much linked to this undernutrition definition. You're essentially not eating enough to maintain good body function. And if we look at data in terms of BAPEN 2021 malnutrition reports, they report that about a quarter of patients coming into hospitals are at risk of malnutrition or already in a malnourished state. So quite a big number that we're having to address. Now, if we look at the other end of the spectrum, which is the overnutrition, this is an even bigger problem. I think as a nation, we accept this as a national problem. I think roughly in terms of costs, it costs the NHS about £6.1 billion a year. So a huge problem that we face and that we need to address quite urgently.
Talk me through the importance of the dietetics role then in terms of easing the patient journey through a hospital.
I think this is an absolutely crucial role, something that can't be replaced or exchanged or removed. It's essential in terms of a patient's recovery pathway. We as dietitians are subject matter experts in food, nutrition and hydration, and we understand it more from a point of how food can really have a positive effect on a patient's clinical outcome. And so to really simply answer your question, is absolutely crucial. We need dietitians in the NHS setting or even a sort of a Sodexo setting to be able to tailor and provide those specific menus to aid patients' recovery.
So who would you be typically working with in a hospital environment as a dietitian?
It's very much a collaborative approach, and that collaborative approach includes trust dietitians. Essentially anyone sitting in the nutrition steering group meeting. That can translate as pharmacists, caterers, trust boards, pretty much everybody that's involved in a patient's care pathway. But I think the very close link is between a trust dietitian and Sodexo dietitians. So trust dietitians will potentially go and physically see a patient on a ward, assess them and put in place dietetic plans, which we as Sodexo dietitians will ensure we have in place to be able to accommodate those requirements and potentially help the patient get better.
And what about the NHS food standards? Do they support and help with your aspirations around improved dietetics?
Absolutely they do. I think the most recent one, which has come out in November last year, has pretty much really reinforced that idea that I think we as dietitians have said right from the beginning, which is food is thy medicine, which is that famous saying from Hippocrates. Without food, patients will not get better. It's quite simple. The NHS Food England strategy, food and drink strategy more specifically, has really, I think, almost made it mandate that food is right on top of the agenda in hospitals, be it in the strategies, in the governing sort of meetings that they have, looking at things like making sure you have a nutrition and hydration drink strategy that's up to date, which is key, making sure that there is someone there at that level governing and championing food. And I think that mainly really needs to be a dietitian by background, because we are the subject matter experts. So it's really reinforced and almost made mandate that you have to have those people in place. They're able to go and see these patients, put in place the recommended interventions to get them out of hospital.
So Hasina, how do partner organisation dietitians like yourself, what kind of benefit do they add above and beyond the dietitians that already exist in hospitals that are NHS employed?
The first thing that we'll do is we'll have those discussions with the trust dietitians to understand the patient cohorts that they are delivering their services to, and then we're able to create those specific tailored menus to ensure that it meets their nutritional requirements. We also, within those menus, provide them in a way that they are nutritionally analysed, so we know they meet the patient group from the nutritionally well to the nutritionally vulnerable. And so we were able to provide that added service, which unfortunately trust dietitians don't have the capacity to do. We also can help contribute towards training and education of staff, and that could be the catering staff or even the trust staff. We're able to provide that very simple, basic level of education and understanding on nutrition and hydration so that they're able to care for their patients a lot better.
Do you consider the ambitions around net zero and food waste in your planning? Hospitals now have their own green plans and net zero is very much front of the agenda.
Absolutely. I think this is something that we cannot ignore anymore. It's really become part of everyone's initiative and responsibility almost. I think practically as dietitians, the things that we can do from a menu perspective is potentially looking at offering days where we have, no meat days, which significantly will contribute to reducing carbon emissions. If you look at every hospital potentially doing that and the impact that might have in the whole of UK and Ireland. We could also look at seasonal menus, which has a positive effect in that sense as well. We look at, utilising ingredients. So if we have a particular ingredient within a meal on one day, maybe utilising it in the next couple of days to really try and reduce food wastage. Those sorts of things which are practical but make huge positive implications from a point of greenhouse effects. So there's lots of things that we as dietitians can do.
So following on from the sustainability challenge, can technology or new ways of working help dietitians improve the net zero objectives?
It most definitely can. I think within Sodexo, one of the initiatives that we've really taken on board is this Waste Watch, powered by the Lean Path programme, which really helps us identify where that food wastage is coming from and how we can best try and act on that. So I think we've implemented it in about 200 sites so far, which has actually resulted in 250,000 tonnes of food being reduced in terms of wastage. So a huge implication, positive implication there. So if we're able to see what's causing that wastage, as dietitians, we can maybe look at ways, very simple ways, to try and prevent that from happening. If there's any particular dishes or meals that are being wasted more than others, maybe when we do our reviews, taking that off and replacing with things that are popular choices but still nutritionally complete.
If you were able to ask senior leaders within health and care to support dietetics in more ways or different ways than they are today, because they all have huge competing priorities and challenges within the system, what would that be? How can they help?
We invest in more of us. There's not many of us out there. If there was more effort in trying to invest in that resource, it would really make that huge difference. My sort of idea of utopia would probably be Sodexo dietitian in every contract, if that would be possible, just because that role cannot be replaced. It's the expertise that's required. You're not feeding public people, you're feeding people that are sick, that are ill, and so you have to have that level of clinical knowledge and understanding, and dietitians offer that. So if I did have one ask, it would be that there would be more of us so that we could have that collaborative way of working, that sharing of best practice, and really sort of tailoring menus and menu offers to meet patients' dietary needs, and that ultimately improves their clinical outcomes.
Hasina, thank you so much for joining me today. I think it's really important and fascinating to understand how the science behind food plays a big part in the patient experience and their recovery. And certainly at Sodexo, as you know, the more we can support hospitals in the quasi-clinical recovery and flow, the better. And that's certainly something that I know you are championing and pioneering. So thank you so much.
Thank you very much.